the last 25 years. The practice of medicine is changing dramatically. All County Healthcare, Inc. still does it the old-fashioned way, where our nurses and healthcare professionals come into your home to service your medical needs, providing you the fastest and best care possible. For more information, call 954-717-7027. And remember, Medicare Home Care is covered by Part A of Medicare with no out-of-pocket cost to you. It's your decision, and only your decision, on what healthcare agency you use. Call today. All County Home Health Care, Inc. at 954-717-7027. License 200999096. The opinions expressed on the following sponsored program are strictly those of the host, guests, and callers, and not necessarily those of this station, its staff, management, or sponsors. Amp2.tv presents You and Your Doctor, teaching you to live a longer and healthier life. Proudly sponsored by All County Healthcare, where people are the heart of our business. All County Healthcare is a Medicare certified agency where one call will service all your home care health needs. For more information, call 954-717-7027 or visit our website, allcountyhealthcare.com. Now, let's get informed to living a longer and healthier life. Here is your host for today's show.
Hello, South Florida and beyond, and welcome to the You and Your Doctor show for Tuesday, May 19, 2020. We're going to be talking a lot about the heart this evening. We have a cardiothoracic surgeon, so I'm really excited to talk about
healthcare has
all
exciting
aspects
news for any and
of
all
the heart
patients
as well. We have joining us, he's on staff at Tenet, Florida Cardiovascular Care. He's a cardiothoracic surgeon. And on staff, I should mention, has an office with Tenet, Florida Cardiovascular Care in Palm Beach Gardens. He's a cardiothoracic surgeon on staff at Palm Beach Gardens Medical Center, Dr. Nishant Patel. Dr. Patel, how are you doing this evening?
Great. Thanks, David. Appreciate you having me on.
Thank you, and I enjoy having you as well, and I just look forward to you taking us I always stay on this adventure of health because we always learn so much, especially from a surgeon. So I can hear you loud and clear. Let's get right into it. Can you tell us first the hot topic? I mean, we've been talking about this a couple weeks now. Tell the listeners and viewers a little bit what has changed in just a few weeks and how elective surgeries have resumed. Is that the case?
That's right. A lot of what I do as a heart surgeon is not truly elective. Matters of the heart tend to be more urgent than perhaps some of the true elective procedures. But yes, as of this past week, elective surgeries have begun. For my practice, I think what I found very interesting as well as somewhat scary is a lot of patients are having issues with their heart, whether it's chest pain or shortness of breath or new symptoms, and for fear of COVID, and rightfully so, have delayed presenting to their physician or to the hospital. And that's actually created somewhat of a more challenging clinical scenario to manage because when it comes to the heart, really time is of the essence, especially when you're talking about heart attacks or other acute heart conditions that require urgent care. And we've seen patients arrive to the hospital somewhat delayed, and that's caused quite a bit more of a challenging scenario to take care of both surgically and medically. But yes, I go to the hospital every day. I haven't missed a day in 3 months. And it's nice to see that, the physician parking lot is more, it's busier. There are more physicians around. Patients are coming in for semi-elective cases. I think a lot of patients still, for appropriate reasons, are not seeking truly elective procedures yet, even though hospitals have begun the process of starting elective cases. But it's been a pretty interesting 3 months, and all the kudos to the nursing staff and the staff in the hospital that keep things moving. The OR staff, for me personally, my ICUs, just a tremendous job under very, very challenging circumstances.
Yeah, thanks for mentioning the nurses. It was just Nurses Week, so we say thank you again to them. And we've seen it in the news. Hospitals are the safest place to be. Hospitals have been clean and sanitized long before this pandemic. And I got to just say about Palm Beach Gardens Medical Center, where you're on staff, has a really a long withstanding reputation for heart care, especially in Palm Beach County. And one of my favorite hospitals. I was born there, so I really. That's one of I have that always, but I have read about the longstanding heart care there. I want to get right into it with some of the things you do because you have a very long areas of interest. Coronary artery bypass grafting. We know it in the news now as CABG. I mean, the acronym is. I think people know the acronym better than actually the words there. So. How is it performed and when is it needed? If we could, we can't get too much into it, but I'll let you explain.
Sure. So coronary artery bypass grafting is really the most common thing that a heart surgeon does. It's our most common procedure. It's the most common heart operation performed in the United States. And basically, it's to put it lightly, it's glorified plumbing. You have pipes on the heart that supply blood to the heart muscle, and for a variety of factors, both genetic, environmental. The vessels on the heart can become clogged up with plaque, cholesterol deposits, and that basically reduces the blood flow to the heart muscle. And the heart is something that beats constantly. We know what happens when it stops. And so when you stress your heart and you're not getting enough blood flow to the heart muscle, it results in something called angina or chest pain. There are various presentations, but essentially patients can come in with chest pain, or they can have heart attacks where there's an absence of blood flow to the heart muscle, and that needs to be restored urgently in the cardiac catheterization lab. And essentially there's a variety of different patterns of disease that would warrant bypass surgery. This includes surgery for something called left main disease, where the disease is at the very proximal part of the artery that supplies blood to the left side of the heart, or patients who are diabetic that have blockages in multiple vessels, and even patients who have anatomy that are not suitable for stenting or angioplasty. And so essentially we perform this operation by rerouting blood flow around the blockages. We use arteries from the chest wall, and we use veins from the leg, and there's actually an artery in your arm, the radial artery, that we can utilize as well. And we basically reroute the blood flow to the muscle around those blockages.
It's one of the questions I had getting right into it about those arteries that you use to redirect and to use on the new treatment that you've created there. So, is it true that only 5% of patients in the U.S. receive multiple arterial grafts during CABG? And tell us a little bit more about multiple arterial grafts and when they're most beneficial for the patient.
Sure. So, the standard CABG operation in the United States, or really in the world, is where we take the left internal mammary artery, which is an artery that sits on the inside of the chest, just to the left of your chest bone, and we put that artery onto the most important blood vessel on your heart, called the LAD, or the left anterior descending artery. And then for any other blockages that you have, we harvest vein using small incision on your leg and a telescope, and we put veins on the other bypasses. And we've known for many years now that the artery bypass itself, the left internal mammary artery to the LAD bypass, is the most durable bypass that we can offer, with the patency rates, meaning it's functioning well at 10 years of in excess of 98%, while vein bypass grafts are much more likely to close down in the long term. So we actually have two mammary arteries. We have an artery on the left of the chest and a right internal mammary on the right side of the chest bone. And it's true that despite the benefits of arterial grafting, which is well known, for some reason surgeons in the United States have been reluctant to utilize both mammary arteries, even though that there's plenty of data that suggest improved survival and decreased readmission to the hospital, decreased heart attacks from using both mammary arteries. So that's right. A recent study in one of our major journals showed that less than 5% of patients who receive bypass grafting get 2 arterial grafts or more. The reasons for this, I think, is it's a much more technical operation, meaning it requires a certain level of comfort and skill to do it over and over again. And heart surgery, one of the reasons I love heart surgery, it's the only field I know in all of medicine where precision and speed are important. And for that, a lot of surgeons, I think, are shy away from using both mammary arteries.
Precision and speed. I like that. I've never heard that, and it's great having a surgeon on to understand things like that. We're here with Dr. Nishant Patel, cardiothoracic surgeon, Tenet, Florida Cardiovascular Care. Number is 561-622-3618 to his office, or you can just put in your browser. If you're watching online, it's drnishantpatel.com, DRNISHANTPATEL.com. Or just, Google Dr. Nishant Patel. It'll come up as well. So, on the other hand, we're talking about the multiple arterial grafts and that 5% question. On the other hand, approximately 50% of your patients receive at least, 2 arterial bypass grafts during CABG surgery. So this has been something that you find, most beneficial to the patient. Probably I'll let you answer the rest, but probably something you've been doing for a little bit of time.
Sure, that's right. And like I said, I think it boils down to a lot of comfort. At the university that I trained at, we did a tremendous number of double mammary artery or multiple arterial grafting bypass surgery. And that's right. So about 40 to 45% of my patients will receive multiple arterial grafts. There's just a tremendous amount of literature that's available to us that show that this is beneficial. And the drawback to it really stems from poor patient selection, which is true of pretty much every surgical specialty. You have to pick the right patient to do the operation in, and if you've done a lot of these types of cases, you can decipher which patient would gain the most benefit from using multiple arterial grafts. So yeah, I've done a fair number. About 40-45% of my cases, I utilize both mammary arteries, and in some patients where I don't feel the second mammary artery is a good idea, if the anatomy is suitable, we'll even talk to the patient about taking one of the arteries out of the arm, called the radial artery, which in the right scenario has better efficacy and patency than even vein grafts. So lots of options. I think, if you were to ask heart surgeons 5-10 years ago about bypass surgery, they would view that as sort of the bread and butter type of operation. But I think what we've seen in the last 5 years or so is that, it truly is an art form to do bypass surgery, and you can derive the best outcomes for your patients, or as a patient for yourself and your family members and your loved ones, by seeking out surgeons in hospitals, institutions that do a lot of cutting edge bypass surgery work utilizing multiple arterial grafts. And I think it's a great question to ask your surgeon. I know if I needed to get bypass surgery, I would ask them, what conduits or what type of grafts are you going to use, and why? Because it really does make a difference.
Yeah, with people researching everything nowadays, yeah, that is a great point. Ask that question. I mean, you probably, I'm saying from a patient's point of view, they probably looked up everything as well. So it's just one more question. When you have a great doctor like this, you can, get that answer and come up with a plan. He's going to come up with a plan for precision and speed, and what's most benefit for the patient. I know every case is different, and doctors will tell you that, but those are great options. I want to just jump around. So you mentioned your training, and I found this very fascinating because this is a very prestigious hospital and university you trained at. Is it true you completed medical school and your training all at Johns Hopkins University School of Medicine, Johns Hopkins Hospital?
Yeah, but to be honest, I'm a local kid, right? So I grew up in Delray Beach, Florida. I went to Atlantic High School, and I was incredibly fortunate to find myself in Baltimore at Johns Hopkins, and even more fortunate to basically become end up under the tutelage of a couple of absolutely terrific mentors. And for the young listeners out there seeking medicine as a career, you have to really find the right mentor to get where you want to go. And so, sure, I ended up at Hopkins. I stayed there for 17 years and decided to make the trip back home. But Hopkins is a very, very special place. I mean, number one, the patients are just, they really are in need. We see patients from all over the world there with some of the most challenging, complex clinical scenarios. And then I was very fortunate to be trained by, the Babe Ruth, Tiger Woods, Michael Jordan of surgeons, and every colleague that I interacted with at that hospital was the who's who in their specialty, which as a trainee provided absolutely tremendous amount of education.
Yeah, that is great. I didn't know Delray Beach. I'm sitting right here in Boynton Beach. I'm from Jupiter originally, so I just learned another thing. I'm learning a lot about the heart and heart surgery, but that's great. I didn't know that. That is, and came back home. That is great news. Again, it's Dr. Nishant Patel, cardiothoracic surgeon, Tenet, Florida Cardiovascular Care. drnishantpatel.com is his website profile. A lot of info there. You can see all the education and training as well as the certifications, areas of interest. The number's 561-622-3618. Interesting story, and I just wanted to ask because you mentioned barely a little bit about signs and symptoms, presenting. Recently, we had the Super Bowl, and there's a story about a man who, right before the Super Bowl, thought he had indigestion, and it turned out, he had a heart attack, and he ended up seeing you. And I think it was a double internal mammary coronary artery bypass surgery, if I'm correct. Now, we talked a little bit about that, but I wanted to ask you, for men and women, we've been hearing a lot about this. Do we see signs and symptoms that are a little bit different? Because he was talking about, I think, indigestion, and maybe he had a little issue with his arm as well. But is it different for men and women? Is it that drastically different?
Sure, it can be. This particular patient was a younger male who happened to be diabetic, and where we typically see variability in symptoms are female diabetics. But sure, the sign or the symptom of indigestion is a very common complaint that patients have, and they basically attribute their symptoms to indigestion and then end up coming to the hospital because the symptoms persist or worsen. But yes, that's absolutely common. Indigestion, the left arm pain, the crushing chest pain, those are more common symptoms. Jaw discomfort, back pain. There's a variety of different symptoms. And I think especially in this time of COVID, I think it's important that if you're feeling something that's unusual or different, and you're not able to do what you're normally able to do in terms of activity, or there's just something not right, and especially if you have a family history, I think it's very important that you seek medical care.
And going into sports, so looking back a year from now, CC Sabathia, the pitcher of the New York Yankees, I just read that story recently again because I was looking to see CC Sabathia, just long story short, just shared some photos on Instagram and everything, and he is completely ripped, totally took this time to get in really good shape. Not that he wasn't in great shape during his career, but long story short, I read that article, and I barely remember it last year, where he just wasn't feeling right, starting to throw in December before last season. And, he said, talked to his wife, I think I'm going to talk to the Yankees team doctor. Something's not right. And she said, yeah, talk to him. And he had a blockage, a world-class Major League Baseball, first-time guaranteed Hall of Fame ballot pitcher And that really put at home, because normally when we think of cardiothoracic surgery, I think a lot of us think, oh, that's, going to happen to older generation and whatnot. But it can happen to young people, younger people watching the Super Bowl. It can happen to world-class athletes. It doesn't matter. Isn't it true that it could, it could be genetics? It just could be a whole bunch of, a lot of things, right?
Oh yeah, absolutely. Genetics plays a tremendous role. A family history of heart disease in a young patient, so somebody in their 40s, if you have a mother, a brother, sister, a loved one that's had heart disease in their 40s and has had intervention, that family is at risk. And I've seen a tremendous number of patients who are young, fitter than I am, take care of themselves, exercise, eat healthy, but the genetics trump it, and they end up having a heart attack or with blockages that require intervention, whether it's stenting or surgery. So it just goes to show you can only control what you can control, and then there's a whole genetic aspect that can overtake all of that and end up playing a major role in how you present, and if you present to the hospital with symptoms of heart disease.
Yeah, that goes full circle how we started this evening. I mean, definitely go see a doctor if you have any, you're not feeling well. Go to the hospital. It is still the safest place. I mean, like I said, they've been with the gloves and masks long before the general public ever talked about this, and hospitals are very clean as well. So yeah, definitely go see someone. We talked a lot about CABG, and there are some other types of procedures, treatments you do, and if you wouldn't mind getting into it, tell us a little bit about some of the heart valve treatments you do, as well as this is something that we've seen a little bit more of, is AFib surgery, or atrial fibrillation surgery, and then follow that up with aortic aneurysm surgery. Some of your your areas of interest, I think, starting with TAVR. I should have started there with the aortic valve.
No. My favorite operation to perform is really aortic surgery. I did a lot of that kind of work in training. These are aortic aneurysms. In general, when I was in training, I did a lot of them in patients who had genetic disorders like Marfan syndrome, where your tissue in your body is a little weak, and there's some other genetic issues, and essentially patients develop a dilated aorta that can actually pop like a balloon or tear, and that can be life-threatening. So I enjoy those operations, and I love getting called in the middle of the night to do them. I don't know what it is. It's just my personality. I really enjoy the challenge, and really opportunity to help somebody who's really at the brink of something terrible. And then valve surgery, that's right, we do aortic valve surgery, I do mitral valve surgery. Aortic valve surgery has been completely revolutionized.
We got about 45 seconds. Go ahead.
Yeah, with transcatheter aortic valve replacement. But I do the full gamut of all valve surgeries and AFib surgery as well.
Well, we ran out of time there. So again, it's drnishantpatel.com. 561-622-3618. Dr. Patel, thank you again for this opportunity and talking to us a little bit about the heart.
You got it. Thanks for having me.
Thank you. We'll see you next time on the You and Your Doctor show.
Thank you for letting us share with you a longer and healthier lifestyle. If you have a doctor or are a doctor and wish to be on the show, call AMP2 TV at 866-244-5422, and we will put you on the air as soon as possible. Tune in next week for more information on living longer and having a healthier life. The opinions expressed on the preceding sponsored program were strictly those